Dear Congressman LaLota, I wrote this letter for you here today because you're not holding town halls, and we have some really serious concerns about Medicaid, and this is what I wrote. I signed this letter today to express my deep concern about the looming cuts to Medicaid, which will impact 138,000 of your constituents, including 13,000 people with disabilities, nearly 30% of the children in your district, and nearly 18% of the seniors in your district. I read the letter that you sent to Speaker Johnson, where with several of your colleagues, you decry cuts to Medicaid, while you instead advocate for reforms to Medicaid. I would argue that reforms is simply a more palatable word for the cuts that you seek. You joined your colleagues on April 10th in voting for a budget resolution to cut $800 billion from the House Energy and Commerce Committee, which oversees Medicaid. It is mathematically impossible to find that level of cuts from the committee without significantly impacting Medicaid and the health care that your constituents receive. You have said that reforms will prioritize work requirements for able-bodied adults when we know that the overwhelming majority of people on Medicaid do work. We work hard. And those who don't are caring for dependents, are disabled, or in school. You will not find your $800 billion there. You've stated that you want to ensure benefits only go to legal residents. However, undocumented immigrants, you should know, are barred from receiving federal Medicaid funds. You will not find your savings there either. Finally, you have suggested an increased frequency of Medicaid eligibility assessments from every 12 months to every 6 months to help prevent fraud and abuse. This recertification process is already very burdensome and can take many months. This often leads to gaps in coverage, during which people who should qualify for Medicaid are uninsured while they're in the recertification process. Forcing individuals to recertify more frequently would lead to added bureaucracy and more people presenting to emergency rooms without care coverage when they do qualify, and increased costs in the health system. Most people continue to qualify for Medicaid coverage over time, unless they see significant changes to their income. The bureaucratic costs that would be associated with an increased frequency of certification would not yield the $880 billion you're looking for. It would be a cost to the system. Your colleagues also speak of reducing the federal share of Medicaid and shifting costs to the states. Currently, 59% of federal funds received by New York State go toward Medicaid. Reduction of that level would place a significant financial burden onto New York State, which would then be forced to limit eligibility or quality of care, raise taxes, or cut programs elsewhere like education. I want you to understand that I am paying close attention to this process. We all are. It's difficult to understand how you can vote for a budget resolution that would most certainly cut Medicaid and then just days later claim that that's not what you wanted to do at all. The savings you see cannot be found through the reforms that you advocate for. These reforms are simply solutions to problems that do not exist in the Medicaid system. I ask you not to commit only to Medicaid cuts, but also to no changes to Medicaid policy and the manner in which it is delivered to your constituents.
What democracy looks like.